Welcome to another nursing mindset video. Today's content is going to be about herbal supplements. So today's nursing mindset is this: if you don't ask, you won't know. When you hear the word medication, you probably think about prescription medications or over-the-counter medications even. But many patients take something else every day that can be just as important: herbal supplements. And here's the challenge. Many patients don't think of herbals as medications. They think of them as just vitamins, teas, natural remedies, or just health supplements. So if we only ask what prescription medications you take, or even if we just ask what prescription medications and over-the-counter medications you take, we may miss a very important part of the patient's health history. So don't assume your patient's just going to tell you what they take. One of the simplest ways to prevent medication-related problems is by asking better questions. So instead of just asking, do you take any medications, be more specific. Try asking, what prescription medications do you take? What over-the-counter medications do you take? And do you take any herbal supplements, vitamins, teas, essential oils, or any other over-the-counter supplements? That small change often leads to a completely different conversation. Patients won't tell us what we don't ask about. And if we don't know that they're taking herbals, we can't recognize possible interactions or safety concerns. Remember, natural doesn't always mean safe. One of the biggest myths surrounding herbal supplements is that because they're natural, they're harmless. But natural substances can still produce powerful effects in the body. They can cause side effects, they can interact with prescription medications, and they can increase the risk for serious complications. Another important point is that herbal products aren't regulated the same way as prescription or even over-the-counter medications are. That means product quality can vary, and what's listed on the label may not always reflect what's actually in the bottle. As nurses, part of our role is helping patients understand that natural doesn't automatically mean safe. Now, there are certain situations where herbal use becomes especially important. For example, if a patient is taking anticoagulants, some herbal supplements can increase the risk of bleeding. If a patient is scheduled for surgery, certain herbals may interfere with anesthesia or increase surgical risks. Pregnant patients, breastfeeding mothers, and children also require extra caution because safety information may be limited for many herbal products. These are situations where asking about herbal use isn't optional. It's an important part of a complete assessment. Patient teaching is part of safe care. Now, many patients simply don't realize that they should mention herbal supplements to the healthcare providers. And that's where nurses make a difference. Encourage patients to tell every member of their healthcare team about all herbal products they're using. Teach them to read labels carefully. Encourage them to look for products with USP verification when available. And remind them to talk with their healthcare provider before starting a new herbal supplement, especially if they're taking prescription medications. If surgery is planned, it's also important for patients to understand that many herbal supplements should be stopped 2 to 3 weeks before surgery, unless their healthcare provider gives different instructions. Good patient teaching helps prevent complications before they occur. So, let's talk about our nursing mindset. As nurses, we don't just ask, what prescriptions do you take? We ask, what else are you putting into your body? That one question can uncover herbal supplements, vitamins, teas, and other products that may affect a patient's care. It's a simple question, but it can make a significant difference in patient safety. So here's my final thought. As you continue learning about medications throughout nursing school, remember that safe medication administration includes more than prescription drugs. A complete medication history includes everything a patient takes to maintain or improve their health. When you ask thoughtful questions, recognize potential interactions, and educate patients about safe herbal use, you're helping prevent complications before they happen. Never assume that natural means safe. Instead, ask the question that could change a patient's outcome. What else are you putting into your body? Because that's the nursing mindset. Keep developing yours.